I'm a chiropractor in Sydney, Nova Scotia. I've been practicing chiropractic now for 20 years. Chiropractic is a health discipline that relies on the fact that the body can heal itself. What chiropractors look at is we want to see how the spine's functioning, if there are any restrictions along the spine that could be putting pressure on the nervous system. Those restrictions we call subluxations. How we remove them is by doing a spinal adjustment. So by removing these subluxations, allow the body to heal itself the way it should. Yeah, absolutely. I think what a lot of people know about chiropractic would be more the traditional type of treatment where it's a hands-on adjustment. Usually you hear a cracking sound with that when you get the vertebrae moving, which probably for some people would sound that it's not gentle, but a lot of times that is gentle enough to get things moving. However, some people may not tolerate that quite the same, and so there are different gentler techniques, we'll call them, or lighter techniques. One of the techniques I use is an adjusting instrument called an activator, and that you won't hear a cracking sound with that. You don't physically move the joint, but it stimulates the joint. There's several other techniques out there would include like a light touch. So really it would depend on the chiropractor you see, what type of technique they use, and you can look around till you find one that would fit well for you. It will vary from chiropractor to chiropractor. How I do it when I first see somebody, I usually will do a case history and physical exam, and I also use a scanning equipment where I measure skin temperature and the electrical activity in the muscle along the spine. Once we determine where the problem areas are, we're about to do treatment. Sometimes I'll use a massager just to loosen things up, and then I can do a hands-on adjustment. Or the other thing I offer it's called an activator. This is an adjusting instrument. I'll just show you on here. So basically, if the vertebrae wasn't moving properly, we would use this just to stimulate the joint, and it doesn't physically move the joint, and you don't hear a cracking sound with it. So some people prefer that over the hands-on adjustment. That's a good question. Absolutely. I think the questions you should ask are what type of techniques they use, have them describe the techniques that they use. What I mean by that, there's some are more hands-on, some are be a lighter touch, some would use an instrument to do the treatment. Some chiropractors use different modalities. So that would be the biggest question I would have is what type of technique they use, and see what best fits for you. Have that conversation, see what you're most comfortable with. Well, I think one of the things you could do, where you heard good things from friends that saw a chiropractor, maybe you go in and see the chiropractor they were talking about that they would refer you to, and just get some information from them. Ask about the different techniques that they can do. Some would be more gentle than others, and then you can make an informed decision if that's something you'd be comfortable with, and then maybe go back to your neurologist, have a discussion with the neurologist, and talk about the different types of techniques that are available, and then get their thoughts on it, and then go from there and make an informed decision. I would say that it's worth looking into. So if you haven't tried chiropractic before, it would be something that you may see some benefit with. So we would go through a case history and a physical exam and determine what the best treatment plan would be for you. And basically with the treatment, what we're trying to do is to take pressure off the nervous system. And so by taking pressure off the nervous system, everyone reacts differently, but you may get some relief with that, and that would be worthwhile to look into. Well, that'll depend. When you first come in, what I do in the beginning, I usually see people more frequently. Usually, I would say I'd start somebody off at 3 times a week and then taper the visit frequency from 3 times down to twice, down to once a week. And then you could get to a point where some people come in, say once a month. And the benefits you could see, what I've seen with patients is they see a decrease in the brain fog. They see that improve with the adjustments. The time in between episodes with the dystonia, that can increase increased mobility and stability, as well as a decrease in pain. Now, sometimes the pain doesn't always go away completely, but there is a reduction in painful symptoms. That's a great question. What I would recommend is, and I would say this for anyone with dystonia considering chiropractic, to see a chiropractor, and they will go through a case history and physical exam, and then they will give the recommendations. Maybe I should explain chiropractic a little bit as well. Chiropractic is a health discipline based on the fact that the body has the innate ability to heal itself. And that innate ability to heal is controlled by the nervous system. So what chiropractors do is look towards the spine for any restrictions that could be causing stress to the nervous system and could be causing problems. So that's what we would look at. So each patient would go through a case history and physical, and so it would vary from person to person. So really, to answer your question, you would have to go through that process first and see what technique may help. And by getting stress off the nervous system, you may find that you'll see some benefits in that, and that you don't get that position where you get stuck bending forward. But it really depends on the individual. So it would be worth looking into.